Coronary artery.
Yes, right. This is beginning of right coronary artery, and this is beginning of left coronary artery. Both of them start from beginning of aorta, that is bulbous aorta. And right coronary artery, it's around right side of the heart, goes to diaphragmatic surface, and here it is, gives posterior interventricular branch, ramus interventricularis posterior. Left coronary artery. Left coronary artery, it's a short vessel, near of 2 centimeters, 2 centimeters. And after that, it subdivides into ramus interventricularis anterior and ramus circumflexus. Anterior branch goes to the apex of the heart, and here makes anastomosis with posterior, ramus interventricularis posterior from right coronary artery. And ramus circumflexus, it's around left side of the heart, goes in coronary sulcus and makes anastomosis with right coronary artery. That is why 2 anastomosis, one in horizontal plane between ramus circumflexus and right coronary artery, and one in vertical plane between ramus interventricularis anterior and posterior. What are they supplies? Right coronary artery, it supplies right atrium, part of anterior wall of the right ventricle, whole posterior wall of the right ventricle, and most part of posterior wall of the left ventricle, posterior 1/3 of interventricular septum, all papillary muscles in right ventricle. How many papillary muscles in right ventricle? 3. And posterior papillary muscle in left ventricle?
2.
All right artery supplies only posterior muscle. Left coronary artery supplies left atrium, most part, all anterior wall of the left ventricle and most part of anterior wall of the right ventricle, part of posterior wall of the left ventricle, anterior 2/3 of interventricular septum, anterior papillary muscle of the left ventricle, and interatrial septum. Now, veins of the heart. 3 types of veins we can see. Main vein in heart, that is what? Coronary sinus. Except coronary sinus, we also have anterior veins of the heart, vena cordis anterioris. They are on anterior surface of the right ventricle and opens directly into right atrium. And smallest vein, vena cordis minima. They also opens into right atrium. And now coronary sinus, sinus coronarius cordis, it receives 5 veins. First, that is large vein of the heart, vena cordis magna. This vein starts from the apex, passes in sulcus interventricularis anterior around left side of the heart and continues into coronary sinus. Then small vein between right atrium and right ventricle, vena cordis parva. And middle vein, vena cordis media. It is in sulcus interventricularis posterior and opens into coronary sinus. And last 2 veins, posterior vein of the left ventricle and oblique vein of the left atrium. Last vein here it is impossible to see. Oblique vein of the left atrium and posterior vein of the left ventricle. Now, topography of heart. Can you give me a piece of paper or copybook? Thank you. My diagram is only for your understanding, not necessary to draw. What is it?
Sternum.
This is clavicle. This is ribs first, second, third, fourth, fifth, sixth, and seventh. And now, superior border of the heart is at the level of cartilages of the third rib, that is third rib, cartilages of the third rib, that is superior border of the heart. Right border of the heart start from cartilage of the third right rib and descend to the cartilage of the fifth right rib. Apex of the heart. What is this line? Mid-clavicular line, that is fifth rib. Here it is fifth intercostal space, and if we take 1.5 centimeter medially from mid-clavicular line in fifth left intercostal space, that is apex of the heart. And now, inferior border start from cartilage of the right fifth rib and goes to the apex, and left border start from the cartilage of the third left rib and goes to the apex. Clear it is? Now, projection of valves. Valve aorta. Valve aorta is, projection of valve aorta is behind of sternum at the level of third ribs. And valva trunci pulmonalis in place where third left rib attached to the sternum. Bicuspid and tricuspid valve, projection of these valves on oblique line, this line from third left rib to fifth right, and superiorly here, this is mitral valve or bicuspid valve, mitral, and inferiorly here, tricuspid valve, tricuspid. That is valva aorta, and here it is pulmonary trunk. Put here P, pulmonary trunk. That is projection of valves. And now points of auscultation of valves. Do you listen heartbeat? And first tone in this case, that is mitral and tricuspid valve, and second tone, that is aortic and pulmonary trunk. And points of auscultation, valve aorta, we can listen in second right intercostal space near of sternum, and pulmonary trunk in second left intercostal space near of sternum. Mitral valve on the apex of the heart here at apex. Where is apex? In fifth left intercostal space, 1.5 centimeter medially from what? From mid-clavicular line. And tricuspid valve in place where fifth right rib attached to the sternum. They are points of auscultation of valves. And last moment. Pericardium. You already know that a heart heart is in pericardium. Pericardium, that is pericardium. And pericardium has fibrous layer, external fibrous layer, and inner layer is serous, pericardium serosum. And serous layer, has parietal. Now I draw parietal layer, and in the region of large vessels, for example, that is aorta, start from left ventricle. From right ventricle start what? Pulmonary what?
Trunk.
Pulmonary trunk. In the region of large vessels, pericardium serosum goes to heart and continues into visceral layer. Visceral layer. And visceral layer, that is what? Epicardium. This is parietal layer, visceral, and visceral, that is epicardium. Space between parietal and visceral layer, this is, what is this space? Pericardiac cavity. Here small amount of fluid, serous fluid, it decreases friction between them. And between pericardium and heart we have two sinuses. One of them is behind of large vessels, behind of pulmonary trunk and aorta. This is pulmonary trunk, here it is aorta, and this place behind of large vessels, that is transverse sinus, sinus transversus pericardii. And if we move heart upward on posterior surface of the heart in diaphragmatic surface, we will see oblique sinus of pericardium, sinus obliquus pericardium. Well, that is all. Your question?